Hi, I'm Dr. Sasha Obaid, a board-certified plastic surgeon, the founder of North Texas Plastic Surgery, and an 18-year experienced BBL surgeon. I want to tell you a little bit about how the procedure has evolved and what modern technologies you need to look for to get you the ultimate result. First things first, safety has become critical, and we've made such massive advances in safety when it comes to fat transfer to the buttocks. When the procedure was originally invented, the fat was purposely transferred into the muscle, not the fat of the buttocks. The thought process being that the muscle had great blood flow to it and thus would support the newly grafted fat the best. The problem was that fat can actually escape into that great blood flow, into those big blood vessels, and then travel backwards into the heart and lungs and have really disastrous consequences. What we learned was we've got to transfer the fat not into the muscle, but into the fat of the buttocks and completely avoid the muscle. So the first evolution in BBL came from learning that we need to transfer the fat into the fat, not into the muscle. Once we started doing that, we ran into another problem, which is you're not actually looking and seeing where you're transferring it. You're doing it blind and by feel. And of course, really experienced surgeons like myself, we felt like, hey, as long as we think that we're in the fat and it feels like we're in the fat, we must be in the fat. The reality though, is it's a lot more subtle than we realized. When we looked at some of the bad outcomes that happened in other practices where patients had this fat embolism phenomenon, the surgeons there thought they were transferring the fat into the fat when they were really transferring it into the muscle and then into the blood vessels and then into the heart and lungs. And so the biggest technological advance today in BBL surgery is UltraBBL or ultrasound. I use an ultrasound when I transfer the fat every time in a BBL. With the ultrasound, I can watch where that fat is being placed precisely. I can be 100% sure that it is going in the fat and not in the muscle. By making sure the fat is transferred into the fat, we can eliminate any risks of that fat migrating backwards into the heart and lungs, and thus we can make the procedure extremely safe. So the first thing I'm going to advise all of you who are watching this video is make sure that you are having your BBL done by someone who uses the ultrasound technique or ultraBBL. Now, beyond just the safety, there's tremendous aesthetic benefits from ultraBBL. Just transferring it into the fat isn't enough. We need to know exactly where in the fat we place it. So if you look at the way our buttocks is built, we have skin, we have fat, we have a layer of what we call superficial fascia, then we have deep fat, and then we have muscle, okay? And then those big blood vessels we were talking about. So the key is we wanna make sure that the fat is transferred not in that superficial layer in between the skin and that first layer of fascia. Because what happens is that first layer of fascia is thick, it doesn't expand. And so what happens is we inject the fat in that superficial layer and the fat disperses out to the side instead of stretching the buttocks up. So instead of getting projection, we get a wide, flat buttocks. Picture almost a manhole cover buttocks, okay? Nobody wants that. So the key is we have to get the fat deep in the deep fat layer, obviously above the muscle. If we can place it precisely there, what we find is we get much more projection, a bigger, rounder buttocks, as opposed to a flat, wide buttocks. And if we place it precisely, we actually have to use less fat to get that same result. In addition, the fat survives better in that layer. So one of the other complaints when we first started doing BBL was that there was only so much of the fat that we transferred that survived. By placing it precisely in that layer and watching to make sure we're not clumping it together, we're spreading it out evenly, we've drastically reduce the amount of fat that gets reabsorbed. And so now we're getting much more consistent shape, projection, and retention of the fat that we're transferring. This is especially important for patients that are skinny when we start, okay? So we can actually do skinny BBL because of that ultrasound, because we know that we're gonna get a lot of bang for our buck with the fat that we transfer because we know exactly where it's going. The next big technological advancement has been Avel. So one of the big limitations of fat transfer to the buttocks has been cellulite. The reality is, just transferring fat to your butt does not get rid of cellulite. Cellulite comes from bands that attach the skin to the muscle underneath. And those bands pull the skin in certain areas and cause those dimples that you see as cellulite. You can inject all the fat you want around the cellulite area, and what'll happen is you'll actually puff up the skin around the dimple and you'll actually make the cellulite worse, not better. That was another thing we didn't realize for many years with BBLs. Now introduce the Avel device. The Avel device literally allows us to select out the bands that cause each and every dimple that you have. It allows us to cut those bands, which then when we transfer the fat underneath, allows that skin to expand and significantly improve your cellulite. We don't want a bigger dimpled butt. We want a bigger, rounder, smoother butt, okay? And that's where the Avel comes into play. At the end of the day, as you're looking around at BBL surgeons, I want you to insist on the very best technology. And that comes from having the ultrasound and the Avel, the UltraBBL paired with the Avel to make sure that you are getting the best possible BBL result. If you have other questions about UltraBBL, Avel, or anything plastic surgery, feel free to DM us below. Feel free to message us, comment us, check out our website, northtexasplasticsurgery.com. We'd love to visit with you. Thank you so much.